My name is Brianna Janowski, and I'm a Managing Director at ATI Advisory. I am pleased to welcome you to this training on what Medicaid officials need to know about Medicare Advantage supplemental benefits. This training is part of a Medicare Advantage Policy Basics video series developed by the Center for Healthcare Strategies with support from Arnold Ventures, the Commonwealth Fund, and the SCAN Foundation. The goal of the Medicare Advantage Policy Basics video series is to support Medicaid and partner agency staff as they build needed Medicare capacity. Many states are focused on improving care delivery for individuals duly eligible for Medicare and Medicaid. State Medicaid agencies focused in this area are increasingly using state contracts with dual eligible special needs plans, or DSNPs, to advance their related goals. For state officials either actively working with DSNPs to advance integration or just beginning to consider how best to contract with DSNPs, it is essential to understand how the federal Medicare Advantage program works. So, each of the training videos in this series begins by introducing foundational Medicare knowledge before reviewing some of the policy and program design opportunities that are available to states. The trainings also cover why particular features of the Medicare Advantage program matter to state Medicaid and partner agencies working with DSNPs. Finally, they highlight where viewers can find additional resources and supports to learn more. Now, let's review what we'll cover today on Medicare Advantage supplemental benefits. After reviewing today's learning objectives, we will present foundational information on the different types of Medicare Advantage supplemental benefits and their relevance to Medicare Advantage enrollees. We'll then shift to reviewing some of the factors that affect plan benefit design and explain why all of this matters to states. We'll conclude by sharing some key takeaways and highlighting where to find additional resources. Through this training, you should become more familiar with 1, the different types of Medicare Advantage supplemental benefits that may be offered, 2, their relevance to states, duly eligible individuals, and health plans, 3, how these benefits are funded and some of the factors influencing what is offered, and 4, opportunities for states to better understand these benefits and potentially influence their design. We'll begin today by introducing the various types of supplemental benefits that can be offered by Medicare Advantage plans, along with their relevance to enrollees. The most fundamental principle to understand about dual eligible special needs plans, or DSNPs, is that they're Medicare Advantage plans, and so they operate under the regulations and policies of the Medicare Advantage program. For example, like all Medicare Advantage plans, DSNPs provide coverage for all Medicare benefits, including prescription drugs, for people who choose to enroll. They may also offer extra supplemental benefits beyond what the Medicare program traditionally covers. The Centers for Medicare and Medicaid Services, or CMS, is responsible for administering the Medicare Advantage program, which includes contracting with private companies, commonly referred to as Medicare Advantage organizations, or MAOs. MAOs can apply to offer a wide array of Medicare Advantage plans, including DSNPs. It's important to note that DSNPs enroll only individuals who are duly eligible for Medicare and Medicaid, which is unlike non-DSNP Medicare Advantage plans that can enroll both Medicare-only and duly eligible individuals. DSNPs are also required to have contracts with Medicaid agencies in states in which they operate. However, it's important to note states are not required to contract with DSNPs, and they may use their contracting authority to add contract requirements that advance Medicare and Medicaid integration. DSNPs must develop and implement a model of care approved by the National Committee on Quality Assurance, which is also known as NCQA. This outlines how the DSNP will meet the unique needs of its enrollees. Finally, DSNPs must, at a minimum, coordinate their enrollees' Medicaid benefits. There are a few reasons this training for state officials is focused on developing an understanding of key features of the Medicare Advantage program and DSNPs more specifically. We focus on building states' understanding of Medicare Advantage, and more specifically of DSNPs, because DSNPs are available in nearly every state, and building knowledge in this area is essential for improving the care of the growing number of DSNP enrollees. We focus on building state capacity because, although DSNPs must follow rules set at the federal level, it is states, through their state Medicaid agency contracts with DSNPs, that have significant opportunities to improve care delivery and help advance health equity for dually eligible individuals. These contracts are commonly referred to as SMACs. As CMS promulgates rules and guidance for the Medicare Advantage program, federal Medicare policy is continually evolving. So, it's important for states to both understand Medicare policy basics and keep up with key changes. Now, let's talk more about supplemental benefits. As we said before, Medicare Advantage plans cover all statutorily required Medicare benefits and also may offer additional benefits. These are known as supplemental benefits. Offering supplemental benefits is a key way that plans compete for membership. For people enrolling in Medicare Advantage plans, including those who are dually eligible for Medicare and Medicaid, the supplemental benefits offered may influence their plan choice. People enrolled in original Medicare, however, do not have access to these supplemental benefits. The design of supplemental benefits and the dollars available to finance these benefits varies by plan. Later in today's training, we'll discuss how these benefits are financed and why plans may vary in how they design them. Historically, Medicare Advantage plans could provide supplemental benefits, but they had to be primarily health-related and uniformly available to all plan enrollees. Examples of these primarily health-related benefits are dental, vision, and hearing services. Recently, CMS expanded its definition of primarily health-related benefits, which allowed Medicare Advantage plans to begin offering a broader array of this type of supplemental benefit. Plans can offer benefits that diagnose, compensate for physical impairments, act to address the functional or psychological impact of injuries or health conditions, or reduce avoidable emergency and healthcare utilization. We will review a few examples of these benefits in a moment. Also recently, CMS started allowing Medicare Advantage plans to offer what it calls special supplemental benefits for the chronically ill, or SSBCI. A special supplemental benefit for the chronically ill must have a reasonable expectation of improving or maintaining the health or overall function of the chronically ill enrollee. Plans can offer these benefits to enrollees with a broad range of chronic conditions, or they can tailor these benefits to address the needs of enrollees with certain social risk factors. Special supplemental benefits for the chronically ill can take the form of reduced cost sharing for Medicare covered benefits, reduced cost sharing for primarily health-related supplemental benefits, additional primarily health-related supplemental benefits, non-primarily health-related supplemental benefits, such as meals beyond a limited basis, food and produce, non-medical transportation, and structural home modifications. CMS is responsible for assessing plans' supplemental benefits offerings and proposing rules to help ensure that enrollees can access these benefits and that those supplemental benefits aimed at addressing social risk factors are effective. Here we present some examples of common supplemental benefits that correspond to the three categories we discussed on the last slide. You can see how their focus has evolved over time. From left to right, the benefit examples move from those focused on addressing primarily health-related needs to those that, if offered, can address some long-term services and supports needs, to those focused on social risk factors and related needs. You will see primarily health-related supplemental benefits include vision, hearing, and dental services, as well as gym memberships and coverage of over-the-counter medications and supplies. In terms of expanded primarily health-related supplemental benefits, those include benefits such as adult daycare services, home-based palliative care, in-home support services, which are also known as personal care services, and non-emergency medical transportation. And finally, example special supplemental benefits for the chronically ill include social needs benefits, food and produce, and transportation for non-medical needs. While the plan-specific supplemental benefits that are offered can change yearly and vary across states and plans, in recent years we have consistently seen dental, vision, and hearing as the most commonly offered primarily health-related benefits. In-home support services as common expanded primarily health-related benefits, and food and produce as common special supplemental benefits for the chronically ill. It's important to note that many supplemental benefits can overlap with Medicaid benefits, which we'll discuss further in the Why This Matters to States section. Medicare Advantage plans, including D-SNPs, are also able to offer supplemental benefits through the value-based insurance design model. This innovative model gives Medicare Advantage plans the opportunity to improve care quality and reduce costs for Medicare enrollees, including dually eligible individuals. This model helps to remove obstacles to health and healthcare by providing enrollees with tailored, primarily and non-primarily health-related supplemental benefits, such as lower costs for prescription drugs, grocery assistance to help meet nutrition needs, transportation to attend medical appointments, and support managing chronic health conditions. Medicare Advantage plans may tailor their plan benefit design to address specific enrollee needs based on chronic condition and/or socioeconomic characteristics. For more information about CMS's value-based insurance design model, you can visit the sources included at the bottom of this slide. So why are supplemental benefits important to people with Medicare, including dually eligible individuals? First, supplemental benefits allow Medicare Advantage enrollees to access services that otherwise would not be available in original Medicare. This can reduce their out-of-pocket costs for services such as dental, vision, and hearing. Supplemental benefits can also provide access to some long-term services and supports, which may, in theory, delay or prevent the need for a long-term nursing facility stay. The availability of supplemental benefits that address long-term care needs may also delay or prevent an individual from needing to spend down their assets to qualify for full Medicaid benefits. However, this would depend on the scope and actual utilization of available supplemental benefits, among other factors. Lastly, certain supplemental benefits may help to address social needs and environmental factors that impact health, which are both areas where people with Medicare can have significant needs. States and plans can work together to examine these opportunities. I want to also note that reducing overall out-of-pocket costs is especially important for dually eligible individuals that qualify for Medicaid based on low income and limited resources, since they are disproportionately impacted by social and environmental factors influencing health. These benefits can also help Medicare beneficiaries that qualify for Medicaid under a state's medically needy program. While supplemental benefits can be very important to Medicare Advantage enrollees, I want to point out a few challenges in the way that supplemental benefits are described and delivered that are helpful for states to understand. First, it can be difficult for potential plan enrollees to understand and compare supplemental benefits across plans, particularly in the amount or level of benefits available. The Medicare Plan Finder, which is used by potential enrollees to compare Medicare Advantage plans, is limited in how it displays information on supplemental benefit offerings. This creates challenges for people with Medicare and those who may be assisting them with enrollment decisions. This challenge can also exist for counselors with state health insurance assistance programs, or SHIPs, that are tasked with helping people make informed plan choices. Second, certain supplemental benefits can overlap with those covered by a state Medicaid program. This can be challenging for dually eligible individuals that, absent integrated care programs, have to navigate which program covers which benefit. Ultimately, this can complicate processes like filing an appeal related to the denial of an overlapping benefit. Third, once enrolled, people in Medicare Advantage plans, including those who are dually eligible, may need help understanding the eligibility criteria and scope of supplemental benefits available to them, such as understanding if they are eligible for personal care services and how many hours of personal care assistance they will be approved for. Given the flexibility that Medicare Advantage plans, including D-SNPs, have to design the supplemental benefits that they will offer, and the importance of these benefits to plan enrollees, it is crucial for state Medicaid agencies to understand how these benefits are funded and the factors that influence plan decisions on what benefits to offer. With all of this in mind, we'll now shift to reviewing how Medicare Advantage benefits are financed and designed. So, how do Medicare Advantage plans pay for supplemental benefits? Plans submit bids each year that estimate plan-specific revenue and costs, and itemize how they will use available dollars to fund basic benefits, administrative costs, margin, and any supplemental benefits. The cost of supplemental benefits is not included in CMS's benchmark rate that Medicare Advantage plans bid against. Instead, supplemental benefits are paid for using what are called rebate dollars, which are generated when a plan's bid is below a predetermined county benchmark. Plans with higher quality ratings retain more of the rebate amount, and so can spend more on supplemental benefits. Let's look at an example to help illustrate how rebate dollars may vary by plan. On the right-hand side of the slide is an example of how a plan's rebate is calculated. If a county benchmark is $1,000 and Plan A submits a bid at $1,100 and Plan B submits a bid at $900, Plan A will not receive a rebate. However, depending on Plan B's star rating, Plan B will receive some amount of rebate. This will be a percentage of that $100 difference between the benchmark and the plan's bid. Plans with higher quality ratings will be able to retain a higher percentage of their rebate dollars. There are other training videos in this series focused on the Medicare Advantage payment policy and the Medicare Advantage star rating system that can be viewed if you want to learn about either of these topics. It is important to keep in mind that some plans receive no rebate, and in plans that do receive a rebate, that amount can change from one year to the next, which can make it difficult to predict whether a plan will be able to provide the same level of benefits from year to year. It can also be helpful for states to learn more about any overall trends in Medicare Advantage rebate amount, including how current trends may impact DSNPs operating in their state. In addition to understanding how plan rebates are calculated, it's useful to know how plans may spend their rebate dollars. Using calendar year 2023 as an example, plans received an average rebate of $196 per member per month, and approximately $50 of the average plan rebate went to provide Part A and Part B supplemental benefits. The majority of the average rebate for all Medicare Advantage plans was used to cover enrollee cost sharing, which doesn't apply to many DSNP enrollees. The remainder of rebate dollars were used to cover either monthly premiums or Part D supplemental benefits. As indicated on the slide, this analysis represents the average rebate for non-DSNP Medicare Advantage plans. State Medicaid programs pay for most dually eligible individuals Medicare cost sharing, including Medicare premiums and co-payment coverage depending on the individual's eligibility category. This means that DSNPs generally do not need to use rebate dollars to cover these costs. As a result, they can spend a greater proportion of their rebate dollars on supplemental benefits than the average non-DSNP Medicare Advantage plan. States can ask their DSNPs to share how available rebate dollars are used. They can also work with their plans to better understand how they design their supplemental benefit packages. So, how do plans decide what supplemental benefits to offer? Once plans know what their rebate amount will be for a given year, they must then consider several factors. Medicare Advantage plans, including DSNPs, use supplemental benefits to set them apart from other plans operating in the market and make themselves competitive. So the plan will first look at which benefits are most attractive to potential enrollees. Certain benefits sell more than others, over-the-counter drug benefits, for instance. Here is an image from Medicare Plan Finder showing the supplemental benefits covered by 3 different Medicare Advantage plans. An individual who needs medical transportation, for example, and is comparing plans may be more likely to enroll in the plan that covers transportation. Plans also need to consider provider networks. They need to have providers in order to offer supplemental benefits, and it may be challenging to build networks in certain locations or for certain benefits. Plans may also look at utilization of certain supplemental benefits and factor that into their decision to continue or stop offering benefits in future plan years. In addition to weighing these factors, DSNPs must consider upcoming Medicaid managed care organization procurements, consider areas of Medicaid benefit overlap for aligned DSNP programs, and factor in any state Medicaid agency contract requirements related to supplemental benefits. For dually eligible individuals who receive full Medicaid benefits, the supplemental benefits offered by a Medicare Advantage plan may overlap with benefits provided under the state Medicaid program. We've highlighted here the Medicare Advantage supplemental benefits that most often overlap state Medicaid programs. There is variation across states in Medicaid coverage, including potential overlap with benefits available under a state plan versus waiver programs. However, in all cases, the state Medicaid program is the payer of last resort. DSNPs that are capitated by the state Medicaid agency to provide Medicaid benefits can provide those same benefits as Medicare Advantage supplemental benefits, as long as they are not paid twice, once through Medicare rebate dollars and once by a capitated payment from Medicaid. For states interested in influencing DSNP supplemental benefit offerings, there are a variety of factors to consider. We've already touched on a few of these, but let's go ahead and move clockwise around the slide to review these all together. First is limited dollars. DSNPs have a limited amount of money to spend on supplemental benefits, and in some cases, DSNPs may have no rebate dollars available for supplemental benefits at all. Second, scope of benefits. Not all of a DSNP's enrollees may have access to all the supplemental benefits the plan offers, and the amount offered of a given supplemental benefit may not be sufficient to meet all of an individual's needs. Third, competition. The DSNP may rely on its ability to offer specific supplemental benefits, like dental, hearing, vision, to stay competitive in its market. Requiring plans to offer other supplemental benefits may affect their ability to attract enrollment and may ultimately drive them from the market. Fourth, market understanding. Supplemental benefit offerings vary by DSNP, so stakeholders, such as state health insurance assistance programs, area agencies on aging, and enrollees need to understand the benefits offered and eligibility requirements for those benefits. Fifth, changing benchmarks. County benchmarks change annually, and Congress can also make changes to Medicare Advantage that may then alter the way plans are paid and ultimately have an impact on plan rebates. And lastly, network. It may be difficult for DSNPs to offer certain supplemental benefits if needed providers are not available. For example, a DSNP may encounter barriers when developing a provider network in rural areas of a state. This could impact the plan's ability to offer a particular supplemental benefit throughout its service area. Now that we have a foundational understanding of Medicare Advantage supplemental benefits, let's review why this matters for states contracting with DSNPs. States can engage with their DSNPs to better understand supplemental benefit offerings in their state. As mentioned earlier, states can start by working with plans to understand their benefits. States can dialogue with DSNPs operating in their state.
Bree, I'm sorry to stop. There was a background noise.
Okay. Yeah, my dog.
I didn't know what it was. I didn't know if it was dog or baby.
Yes. All right. Okay. Slide 21.
Okay.
States can engage with their DSNPs to better understand supplemental benefit offerings in their state. As mentioned earlier, states can start by working with plans to understand their benefits. States can dialogue with DSNPs operating in their state to learn more about supplemental benefits they offer and their plan benefit design. Additionally, through their state Medicaid agency contracts, states can require DSNPs to provide information directly to the state on what supplemental benefits they offer, including coverage details. States may find it helpful to use this information to compare how DSNP supplemental benefits overlap or complement Medicaid coverage. States can also require plans to share utilization data on the supplemental benefits that were provided to enrollees. States can also review and enhance their efforts to ensure Medicaid is the payer of last resort. This can include working with DSNPs to ensure that DSNP supplemental benefits that overlap with Medicaid benefits are being used first and coordination is occurring as appropriate, and assessing how Medicaid third-party liability processes can be leveraged as well. To support enrollees and health insurance assistance counselors, state Medicaid agencies can partner with their SHIPs to build more robust educational resources for dually eligible individuals. And lastly, states and DSNPs can first explore and then partner to enhance or tailor supplemental benefit offerings in ways that meet the unique needs of dually eligible individuals, address understood health inequities, and account for the many factors that influence what benefits plans can ultimately provide. States have clear opportunities to influence DSNP's supplemental benefit design. However, it's important to proceed with caution and understand what, if any, repercussions there could be to a state's DSNP market or benefits for existing enrollees. Now we will cover some key takeaways and available resources in the final segment of our training. Some of the key takeaways from this training include: 1, Medicare Advantage plans can offer a variety of different types of supplemental benefits. 2, a number of factors affect a Medicare Advantage plan's decision about which supplemental benefits to offer, including having limited dollars to cover these benefits. 3, dually eligible individuals need more and better resources to understand how to access supplemental benefits and know how to compare plan options. And 4, there are opportunities for states to better understand and leverage supplemental benefits to meet individuals' needs and address health inequities. Finally, the ability of a state or their contracted DSNPs to take advantage of the policy or program design opportunities covered in this training can vary by state. This is because there is a relatively wide range of state landscapes and levels of integration that states may pursue. Additionally, the Medicare Advantage marketplace varies across states and counties and is impacted by Medicare payment policy, competitive dynamics, consumer preferences, the provider landscape, and other factors. Medicaid officials overseeing DSNP contracts should therefore work closely with health plan partners to develop policies that align with their individual state landscape and goals. There are a number of resources available to states working to integrate care for dually eligible individuals. 4 opportunities are laid out here. States can visit the Integrated Care Resource Center, or ICRC, at integratedcareresourcecenter.com to sign up for e-alerts and access a wide array of materials developed specifically for state officials working to improve care for dually eligible individuals. States can request free state technical assistance by emailing the Integrated Care Resource Center at icrc@chcs.org. States can also contact the CMS Medicare-Medicaid Coordination Office to learn more or develop new or refined policies in this area. You can learn more at the CMS website listed on the slide. And finally, states can work with the DSNPs operating in their state to learn more about this topic area and consider development of related policies. Today's training offered foundational information on Medicare Advantage supplemental benefits. You can view additional training modules in the Medicare Advantage Policy Basics video series to build on today's content and learn more about the following topics: Medicare Advantage contracting and bid development, Medicare Advantage payment policy and rate setting, Medicare Advantage star rating system. Thank you for viewing this video about Medicare Advantage supplemental benefits, part of CHCS's Medicare Advantage Policy Basics video series. This video series was produced in partnership with ATI Advisory and through CHCS's Medicare Academy, an initiative made possible by Arnold Ventures, the Commonwealth Fund, and the SCAN Foundation. To learn more, view additional videos, and access resources to support integrated care, visit the CHCS website listed on this slide.